So hello everyone, thanks for joining us today, and I very much look forward to the second session of our workshop series held in collaboration with the Healthcare Consumers Association in the ACT and myself. Before we get started, I just wanted to let you know that I'm joining today from Ngunnawal country in Nambiland, and I would like to acknowledge and celebrate the first Australians on whose traditional lands we meet or join from today, and pay my respects to elders past and present or any Aboriginal people that are with us today. For online people, you might want to just pop in the chat where you're joining from if you feel so. Also about the chat, I will do my best to simultaneously keep an eye out on comments or any questions. But Shivana from the Healthcare Consumers Association is also here today, and she might pull out questions that I can answer towards the end of this session. So without much further ado, just a little bit about me so you know who I am. I am a senior research fellow here at the ANU Institute for Communication and Healthcare, and I have a background in linguistics and health services research, and I'm particularly interested in improving diagnosis and patient safety through having a closer look at communication. But I also have more than 6 years experience facilitating consumer reference groups, and have also been a consumer representative myself, which I deliberately did because I wanted to sort of see what it is like from both sides. So this is part 2 in a workshop series. Part 1, if you've missed that, is available as a video on YouTube, and Shivana or I can send you the link for that. Week 1 was really focused for health consumer representatives, and giving them an overview of what research really is and how their experiences might fit in and are really valuable in health consumer research or health research overall. This workshop today is working in a similar vein, but it's more geared towards researchers or health professionals, just to give them a bit of an overview of what are consumers, how can we involve them, why would you want to involve them, and if you choose to do, where do you best recruit them, what different levels of engagement or collaboration can you work with, as well as how can you plan and set things up so that they work in the best way possible. So what I want to start with is just looking at defining consumers. And when I say consumers, it really is a bit of a contested term. And oftentimes consumers don't really like to be called that. And obviously there's several ways that you can refer to health consumers. And the preferences are really their own preference. And I just wanted to remind you of this quote here by Shakespeare, and stress that the work and commitment from consumers, regardless of what they want to be called or what they call themselves, is worth what they're giving in. So I'm just using the term consumer here today for the sake of it and for the ease and clarity. It's also what most advocacy groups use. If there are any healthcare consumers here today, and if you prefer a different term, I acknowledge that, but for the sake of clarity and understanding, I'm using consumer here. So you have the words consumer, patient advocate, healthcare consumer representative, and they can all refer to individuals who participate in the healthcare system and advocate for their own needs and the needs of others. And each term has slightly different connotations and nuances. And like I said, I'll use the term consumer to refer to all of them. Oops, I'm sorry. So consumer really is the most general term, and that can refer to anyone who uses a product or service, if you think about it, so including healthcare services. And it's often sort of used in a more broader sense to refer to anyone who's a recipient of healthcare. Patient advocate then really specifically refers to someone who acts on behalf of a patient and ensures that their rights and needs are respected within the healthcare system. And they may help the patient navigate the healthcare system and access the care they need. And then you have health consumer representatives, which are similar to patient advocates, but often with a focus on representation and advocacy. So that means the term really emphasizes the role of an individual as a representative of a larger group of consumers, and also their responsibility to bring their perspectives and experiences to decision-making processes within the healthcare system or research. Then I wanted to make another short note on language before we really get started, and that is that I'll be talking about researchers working with consumers today, or researchers or healthcare professionals working with consumers today. But this is in no way meant to imply that consumers are not researchers. But likewise, not all consumers see themselves as researchers. And I really just use the distinction between researchers as in researchers that are working in research and are being paid for that, and consumers that have an interest in research or might be involved in collaborating in research. And I purely use this distinction just to make it easier for us to understand who or what I'm talking about. And just like it's easier to talk about different flavors of ice cream rather than just ice cream. And apologies to anyone who now wants some ice cream, like me, at lunchtime. So moving on from what people would like to be called or referred to, and what the different ways of framing consumer engagement or collaboration can be. Really, if you now look at or follow this African proverb here, if you want to go fast, go alone. If you want to go far, go together. It really is important to see how far we can go and what we can achieve when researchers collaborate with consumers. And the benefits of consumer collaboration are really vast. The biggest advantages of collaborating with consumers would be, probably most of you would agree, that patients are better off. So there's better patient outcomes, better health outcomes, and this also includes less mortality. So there's less people dying in research or following research that consumers have been involved in. It also improves sort of the relevance and appropriateness of the research. So there's always unique insights and perspectives that consumers can bring, or that their relevance to patients can bring, or families. It increases the quality and the rigor of the research. So especially when it comes to identifying gaps in existing knowledge, because consumers can really help researchers to see outside of the box. We really get sort of bogged down, and sometimes we can't see the wood for the trees or the trees for the woods. And consumers can really help in crystallizing or refining research questions and improving study designs or methodologies, and really having someone in the room when you make decisions about them really leads to much more translatable outcomes in the end. Similarly, you have usually a lot enhanced ethical and respectful treatments of all participants. So consumers can provide feedback on ethical study protocols, on how consent is obtained for participants, and how the research is conducted overall. How do you approach someone, and when do you approach, and when might they be more amenable to participating or not? Consumers can also help in terms of impact and dissemination of research, so they can be actively involved in reaching out to healthcare providers or policymakers. They have channels that they can disseminate through in advocacy groups that they might be part of. And what administrators always like to hear and healthcare systems like to hear is that involving consumers and consumer collaborations really helps to reduce healthcare costs as well. So these are the benefits. So this is why we actually try and strive and do this with them, especially also because it gives patients and consumers ownership of research, and it gives them a say, and it's not just things being done with them, but things being done for them, not just things being done for them, but with them, and sometimes even them leading the research. So if you think about now, we know what the general benefits are, but as you can see, just coming together and just sort of saying, oh yeah, we need consumers to be involved is usually not enough. We need to find ways to get involved, to maintain that involvement, and to really collaborate to achieve success. And success can really look different for different projects. And that's why we really need to have a look at what the different levels and types of engagements can be like. If you look at the landscape in the Australian research space, in 2016, the leading Australian Medical and Health Research Foundation, the NHMRC, so the National Health and Medical Research Council, in collaboration with the Consumer Health Forum of Australia, CHF, which is the national body for health consumer representatives, they've published a joint statement encouraging researchers to involve consumers in all aspects of research. But that does not yet mean that it's a mandatory funding requirement, even though it may affect the outcomes of funding applications. What really complicates the matter is that if you want to do engagement and consumer involvement right, you need to have consumers involved before you even start your grant applications. And funding isn't often available for meaningful consumer engagement during grant application preparation, because that's what you try to get the money for, to involve the consumers and paying them. So oftentimes what that means is that collaborations with consumers really unwillingly become tokenistic, or they're not there at all. A colleague of mine at ANU, Brett Schultz, who's a leader in consumer leadership research, really has called on researchers to make consumer leadership and consumer involvement much more ingrained. So he's calling for researchers to require to show what they did when they claim they have co-designed or co-produced something, to give an accurate reflection, especially also talking about sort of what the power imbalances were in producing this work, but also calling for consumers who are chief investigators as equal partners involved in all stages of the research process, which would require for a lot of the research funding that we have available, policy changes where researchers, consumers can become researchers and fully fledged chief investigators, not just associate investigators, even if they do not have an academic appointment or anything like. So there's huge changes that would need to be in place. So now you've heard me talk for a good 15 minutes, I would say. What I would like you to do, and I will share your results on the screen in a second, is really take a moment to reflect before we look at what the levels or the different levels and types of engagements are. I'd like you to think about how you can actually involve consumers. So really think about what that can be, what you would like from them. And I'm switching over to this side now, and you can share what your findings are, or we can all share what our findings are here. So you can scan the QR code, or you can go to slido.com and enter that number that is on your screen there. And we'll see the results popping up in a second, so please don't be shy. So for anyone that's asking for research currently, there's I'm going to send a PDF of this presentation around afterwards, or probably should say I asked Shavana to do that. And it will have references and links to all the references that I have included on the very last slide, so you can get that from there. You can see our results popping in. Keep them coming. So you can give them a voice, we can involve them in focus groups and surveys and interviews. So there's some things that we can already sort of start to see that are different levels of engagement. So whether participants or consumers are participants in research, or are they researchers, if they're in a focus group, it depends on sort of where you're aiming at with that focus group. Are we looking at just getting information from them? Are we doing a focus group to develop a grant proposal and research questions? Are we doing a focus group as part of our research? Similarly with the interviews. Then you have grant feedback. Involving them from start to finish is a very important piece. Ethics protocols. So you see some of them start to overlap. So developing proposals, identifying priorities, grant feedback, for example, again, you would be more, you would have already established what you are inclined or trying to do, and then moving towards what do consumers actually say, giving them enough time to do and prepare their feedback. I'm going to give you another minute or two. All right, so we can see there's different levels, and that's a really normal thing, and what you would expect, because I said depending on what you want to get out of your project, what researchers want to get out of their projects, the level of engagement might be different, even though nowadays we move more and more towards having fully fledged consumer engagement rather than just having what's sort of considered more tokenistic engagement, as in we develop, or the researchers develop everything by themselves and then sort of just give it to the consumer as a tick box. Here, you read this before I submit it. Really, the idea would be to develop everything with them and then maybe have them do a final review as well, but not just have the final review at the end. So thank you for putting all these in. It's quite interesting to see what the different sort of ideals are. Let me just switch back to our presentation. And then having a look at sort of what the levels of engagement can be. As you can see, here's a quote from the Consumer Health Forum, which talks about that you want to have multiple levels of engagement. So you do not just want to have an individual patient input into a clinical decision, but you want to have them at all levels, sort of from individual participants to sitting on board and organizational committee level. So you want them to be involved in governance. And what you can really see is that there's two really big ways of getting that involvement, and that would be sort of top-down engagement, which has been what has happened pretty much for the past 2 decades or so, where patients have been invited to give feedback or to partner in projects or research, whereas the bottom-up or ground-up partnerships really would be what Brett Schultz has called consumer leadership, where the consumers come up with the questions they want answered and engage with researchers as their collaborators to find answers to these questions and to get funding for that. Like I said before, there's really big continuums of engagement. So consumer partnership or engagement has different sort of levels of how people can be involved. And the Australian Commission for Quality and Safety in Healthcare, for safety and quality in healthcare, I always get it the wrong way around. They really also have recommended from way early on, you can see sort of this is 10 years ago, more than 10 years ago now, that participants should be involved in all sort of elements of research projects. And also not just the projects themselves, but also the governance structures that surround these projects. And that they should be involved from planning, design to evaluation. And we've seen that in the little word cloud that you were building as well, that people are aware that they should be involved from the start to the end. The level of engagement that people pick can really make or break how genuine or tokenistic engagement can be. So if you look at the first one here, information or transactional ways, where it really is a one-way transaction, would be, here is a document, give me your feedback, or here's what we are planning to do, sometimes not even asking for feedback. So really consumers in that space, and when you just look at transactional, informational interactions, are passive recipients of information. And that could be things like even just sort of giving information about new services that are available, let's say hepatitis or shingles vaccines or COVID vaccinations, just sort of passing out information. Then you can move on to consultation. And consultation can be transitional, where there's a two-way interaction, but that can also just be a one-off. So if you have a grant application and you want feedback on it and you send it to someone, you get feedback. Oftentimes what happens is that the consumers never hear about what happened to their feedback ever again. So in that sense, it's not repeatedly going two-way. It's not a real partnership. It's still sort of a transactional one-way thing. Whereas if you ask someone for feedback on your ethics application or on your grant application, they provide that to you. Best practice is inform them back. What did you do based on their feedback? What did you change? Or if you couldn't change it because some parameter of policy, or how research grant applications sort of have particular barriers around them, what people can do or can't do, and explaining to consumers why a certain thing that they might have suggested is not feasible in this kind, but moving on or keeping it in mind for a subsequent study or project. So really, this is the difference from moving from transactional to transitional, having this repeated engagement. Still, the organizational control sort of lies with the researcher. But then we move on into delegation. And delegation is really then moving towards shared control. Delegation means an organization or a researcher identifies an issue, presents it to consumers, and I always want to say consumers, do not just have one consumer as your feedback group. Well, it's not a feedback group, but there should at least be two or the same number as there are researchers, because you need to think of these power imbalances that are in place. But I was talking about delegation. So delegation really is where the researcher organization identifies an issues, presents it to the consumers, and the consumers make decisions about, okay, they agree this is a problem or this is an issue that needs time and research and efforts, and then they make the decisions and propose actions to address the issue. And that can be in collaboration with the researcher, or it can purely be on the consumers, and the researchers are helping them to phrase that into a question. And then there's control, and this is sort of what Brett Scholz is advocating for, where the consumer either comes up with a problem themselves and they are making all the key decisions, or an organization sort of approaches or has a board of consumers that they have established as a group, and they say to them, what do you think is the most pressing issue for X, Y, and Z? And then the consumers identify what the issues are, what the decisions are that need to be done to develop solutions, and how the organization or the researchers can help them in accomplishing that. So you can see how it really moves across from really passive provision of information to really consumer-led change, and from very tokenistic one-off engagement to sustained collaboration and consumer-led change. So what does that look like in practice? So you can have consumers that are engaged as research participants. And that's what I was talking about in the word cloud before, where some people wrote interview or focus group. So obviously we can't really tell from that whether you were thinking of having them as research participants that give you information in a focus group, or having focus groups before to find out what the issues are in the level of sort of delegation that I showed in the slide before. But often what happens is patients are just research participants, and we gather information from them, but we don't really engage with them in the research per se. Then there can be reviewers, as I mentioned, and you also all mentioned. They can look at research proposals and funding applications, study protocols and ethics forms to make sure that they're appropriate and that they're relevant, and that all the questions that consumers might have or all the problems that consumers might face are actually covered in the funding proposal or in the grant application. And then there can be researchers. And that can be the whole gamut of what a researcher does. So developing grant proposals, assisting in data collection, analysis, providing insights into how the data should be collected or analyzed, disseminating findings to their broader community, presenting at conferences, writing articles as co-authors, but also moving into sort of governance structures. So this is where you move slowly into strategic governance. So if you have consumer reference groups, for example, at your organization, if you have a project steering committee or an advisory council, the thing to really consider for those is that you need to have governance, including consumer input, to have the broadest reaching impact. So they should not just be researchers or your participants, but they need to be in places of power where they can make decisions. So if you think about some of the aspects of someone sitting on a strategic governance place, it can have many of the aspects of just being a reviewer. So if people or consumers sit on research reviewing boards or ethics committees, and they review and provide input on research proposals and grant application, and that's it, it doesn't move any further. Then if they are involved in the governance and they have a say about where and how something gets implemented, or advise on translation of research finding into practice, and they help development or implementation of research policies, this is where you really move from having tokenistic one-off engagement into them actually being involved and reducing the power imbalance that there often is perceived or real between consumers and researchers. Then you really want to make sure that you move from sort of the left end of the spectrum towards the right hand of the spectrum. And projects really often, at least traditionally, and when I say traditionally, I shouldn't say traditionally, in the past, maybe, because we don't want to make this a tradition, but in the past, like I said, it was purely we are informing you or we are educating you. And you can see that the arrows really, most of them just go one way in these scenarios. But you want to actually move to two-way engagement. And like I said before, to really move forward requires sort of a holistic change across the entirety of health services research and health services design. And if you look at, there's pockets in Australia where it really works well. Mental health is a huge area that really has embraced and acknowledged the big contributions that people with lived experience can make, but other areas are still lagging behind quite a bit. So you can have, and what Brett Schultz has called for, again, consumer-led development and implementation, where you have guidelines for how consumers should be involved and not just sort of an encouragement as it currently is. That there should be roles for consumers to sit on research bodies, that they are reviewing grant applications, and that there are a fixed stature in committees for these research bodies. And then again, as I mentioned before, that researchers need to show how they've engaged consumers in the development of the processes and work towards including them as chief investigators. So these are the different levels, and I come back to them in sort of some more examples that I'm giving along the way. So now you actually need to know, if I want to involve consumers, how can I get to them? So you need to find out, because if you want to action, but you actually need to go and find who these people are. So what do you think? How could that work? Where would you go? I'm just going to open another little poll for that. Find my other slide. Sorry. Give it a little time. Ah, there you go. So why is that? Ah, here we go. Okay, so the answers are coming in. Stakeholders, yes. Whoever is the person or people involved with the particular issue that you're engaging with, consumer peak bodies, advocacy groups, handing out flyers, consumer networks, going for your own networks. So that tells me that you know where to go. So I might skip over the next bit a bit quicker. But when I said that you're going to get this as a PDF, all the links that are on the next few slides that are coming up are clickable. So it will save you finding out who all the peak bodies or local peak bodies are, at least. Right. Haven't seen anything that I've, so it's always good to sort of, because that keeps me on my toes if there's anything that I forgot to put on my next slide. So let's go back. So you've all said state or local consumer advocacy groups. And this is not an exhaustive list. And I've also, in putting this list together, found out that apparently the state government of South Australia defunded and closed their state consumer advocacy group in 2020. So if anyone's joining here from South Australia, some lobbying to be done over there. Then you have your disease-specific advocacy groups, and then sort of local health services, and you mentioned that as well. If the organization doesn't have anything particularly on their site, you can always contact them. So sometimes they have consumer groups in place, but they are not really publicly advertising that. So there's always usually a consumer or community liaison person that they have, and you can contact them and get information that way. And then obviously by contacting them, they usually put notices or expressions of interests on their website. So one of this here that you can see is from Health Consumers New South Wales and the Health Consumers Council of WA, or on social media. Someone wrote LinkedIn before, so Twitter is just as well. Even though it's usually, I find social media and Twitter can be a bit tricky, because if you don't follow the right people, I'm not saying that they're right or wrong people to follow, but if you don't have that in your extended network, you might not come across it. But people will share usually and get information that way. If you go through your local or state consumer advocacy groups, the good thing is that you have lots of further reach, and you making it an open and a free expression of interest, where multiple people have the potential to apply and really move forward. So what we're going to do now is moving to planning for best practice, and to give you some practical examples. So there's been a framework, and the practical examples that I use are where consumer engagement has been really project specific, or where there's a standing reference group that sort of provides input. So project specific was for a 5-year NHMRC partnership project between industry partners and Macquarie University. And we had a consumer associate investigator who was originally a chief investigator, but because of the way that the partnership grant is structured and the money that is involved, and that wasn't the first time they've applied for this grant. The second time around when they applied, the consumer group didn't have the money anymore, so they needed to switch from chief to actually associate investigator. So those are some of the barriers around true investigation or true involvement that I was talking about before. And then we have the standing health reference group that we have established, for example, at the Institute for Communication and Healthcare, where I work at here. Following a narrative review of 55, I think it was, academic papers, Harrison and colleagues developed a foundational framework for authentic and sustainable partnerships between patients and researchers. And they came up with foundational principles that are respect and equity, trust and empowerment. And they also describe best practice activities and really honed in again on that fact that we need to have these across all research phases. I know this is a lot of information on this slide. This is sort of what if we applied our project specific reference group to their model, this is what we came up with, and you can have another look at that in your own time. But it really just gives you an overview of how interrelated all these factors are, from your foundational principles through your best practices and the research phases when you can do involvement. So here are your 3 engagement foundational principles, and what most commonly reported was respect and equitable power between all team members. And you want to have a democratic and open forum in which parties can express what they feel equally and without judgment. And what is really important to get that is that you do not just have one token consumer at a panel or in a project. Power differences, and even if you feel, oh, I am the most approachable person in the world, power differences just by themselves mean that one person is much less likely to speak up than if there are 2 or 3 consumers in a room, that they can sort of support each other. You want to have trust between consumers and researchers, and ensuring that there's inclusiveness involved. You want to be honest in your experiences, how you worked with consumers before. And if you don't know a lot, say that so you can learn together. And you want to be transparent about what your roles are, and really have a focus on the empowerment. Like I said, having a token consumer, which is often what happens, to have this token person there that often isn't really involved and doesn't get information, is really not the way to go. So what you can do, or one way to define and negotiate roles and responsibilities, is to have terms of references, and that should be a co-produced document. And I want you also to keep in mind that they need or should be, and I'm not saying that ours here is an actual example of that, and it's something that I need to review, but they should be written at a literacy level that is accessible to everyone. Which is an issue that I need to go in and actually review what ours looks like. But really it can help with these foundational principles. So you can have established trust because you have honest negotiation and communication about what the roles are, what the functions are of the committee or of the consumer, what their responsibilities are. And they can also help in terms of weight for decision making for each participant, because if you want to have things like you need a quorum, you might also want to have a specific clause about how many consumers need to be present in a meeting to have a quorum, not just how many people overall need to be present to have a quorum. So moving on from foundational principles to best practice activities. And what Harrison and their colleagues outlined in their framework really comes down to having training and education, not just for the consumer, but also for the researcher. Really having capacity building like we're doing here, or what this workshop series does, is to build capacity among consumers to be active research partners, or to build capacity among researchers to know what consumer engagement and collaboration looks like. Talked about role clarity and matching in terms of references. How can you target particular groups and people that you want to have involved, that you need to have involved? Also asking your consumers that you already have involved, is there someone else? Is there someone missing as part of this conversation? And then having overarching structures and models. And at really having consumers involved in governance structures and not just as researchers can help overcome these power and weight differences in decision making. So capacity building for researchers or health professionals, there are several courses that you can do. Health Consumer New South Wales has staff training, or there's joint consumer or researcher training. We have this workshop series here for consumers. There's also consumer training from the Cancer Council, and I'm thinking there's also consumer training from clinical trials units. But I also don't want to detract from mentoring or buddy systems and how powerful they can be, and sort of really trying to take on the other side as well. Which was one of the reasons for me to become a health consumer, so I know what it's like to be sent a grant application with basically 7 hours notice and then never hearing back about what the outcome was from there. Here's a capacity building workshop that we did for this project specific work that we've done. So we had a qualitative data driven workshop where we had free readings. We did half a day. Every participant was reimbursed, but we did also have some pitfalls to overcome, or some learnings to take away from that. So positive things were that we gave them free reading time, and we gave them the readings ahead of the time, and they had transcripts to look at and some theory to look at, but not everyone read it. So we had to guide them through on the day rather than discussions being consumer-led, which is what we had hoped for. So what we learned is that really to do something like that, you need to have more training scheduled ahead of time and have longer workshop times. And then moving on towards the actual workshop where you analyze things after having introductory theoretical workshops. And then moving on, really this is the crux when it comes to it. And And how do you plan for it? You need to be aware of that. You want to provide financial compensation. And this is a really good way to promote engagement. You want to provide financial compensation and reimbursements for your consumer and your stakeholders' time, experiences, and expenses. You want to have regular dialogues that go back and forth. It's really important for successful engagement. You can appoint neutral facilitators or a consumer facilitator for research meetings, and that can help to remove some of the power differentials that I talked about before, and can also really help facilitate open discussions between the researchers and the consumers. You also want to develop a process for ongoing monitoring and evaluation, and have channels for feedback. So not just seeking feedback, but sort of having an open sort of drop-in box where people can let you know if something's not working for them. And really creating a system that acknowledges and validates the contributions. So now we have one last one last Slido for you to participate in. This one's looking at what do you think consumers should be reimbursed for, or what should they be remunerated for in terms of their expertise? Try to move to slide again. Sorry. This is the learning I take away from this. Don't open them all at the same time. Yeah, here we go. So I'm looking for particular things, practical things. What do you think if you want to involve consumers? Think practically, like if you were someone that got invited to participate. So preparation time comes out again here. That's a big theme. You need to value their time. Travel costs coming up at the same time here. Oh, transport, what they know. Access is a really important one. And access can take multiple forms, and I'll talk about that in just a second. So their knowledge and their expertise, their time, and not just time for the meeting, but also for preparations is what's coming out here. Travel and transport and access. Accommodation, depending on where it is. Yep. Excellent. Feel like you don't need to be here. You already know everything. Let me just switch back. So yes, I think we've mentioned everything. So time, preparation, transport to the event, or accommodation if needed. I think this is something that we've missed. Now I've moved it. Carrying costs. If you really want someone to be involved, and really in terms of what people said about knowledge and experience, if you think about researchers, we get paid to do that stuff. This is our job. People, that consumers should just be paid exactly the same way. And for them, often they face carrying costs. So they have childcare, or they need respite care for someone that they care for, or a support worker to come with them to the event. And that's something that you should budget for in planning for consumer engagement as well. They might not be fluent, or they might not be native speakers of English, or fluent speakers of English. So you should also budget or plan for having an interpreter or translator present. And also, even if it's not in person, internet access and phone credits and printing and even things like ink should be things that you would want to consider, should plan for being able to reimburse people for. And how is that done? Again, here's some links to, there's no nationwide recommendation of how consumers should be paid, but there are local guides for reimbursement and policies around that you can have a look at and use for planning. We've also talked about access, and here are some access barriers. So you want to be able to ensure that people that have mobility or disabilities, that are hard of hearing or deaf or blind, can participate. People that have a different language, people that come from trauma. What your meeting times are really depend on who might be able to be involved. Power differentials I've talked about. And then overburden is really, really an important factor as well. So if you think about people from a marginalized background, Aboriginal and Torres Strait Islanders, or migrants, or someone from LGBTQ backgrounds, they might be asked again and again and again and again and again to represent that particular group, and that might be an overburden for them. So that's something to be mindful of as well. And here's the research phases, and I don't think I need to drum on that, but really involving them across all stages. And what that can look like, and what we've done before, is to have consumer-led research questions and projects. I've done that not at ANU, but in a previous application where we've made a whole grant application and ethics application that then wasn't successful, but that was purely the consumer-led research questions and projects, where we sat down with the consumers and they came up with the questions and they came up with the issues, and it was all around rapid flu testing. And we came up with that in 2019. And it didn't get funded, and I'm afraid to think about what would have happened to this project if it got funded just 6 months ahead of COVID hitting and rapid testing. But it was quite an interesting experience. What we really need to think about in terms of involving consumers is, please give them plenty of notice. I know for researchers, we know what the grant timelines are, and we often have to give them our researcher offices, our applications ahead of time. But if you really want to involve consumers and have dedicated feedback and do something with it, you need to time for it as well. And to, as I said, include consumers in your budget. Don't just ask them for feedback and not involve them. Consumers can also be involved in ethics applications. So this is an example of a project that we had where our original information form just had the title of our project, Communicating End-of-Life Care at the Canberra Hospital, and we sort of discussed this with the consumer reference group that we have, and they suggested, oh, you can't have end of life in there, you're going to scare them, people might not know that they're at the end of life, which is actually something that then happened subsequently in the project, where clinicians identified patients at the end of life, but not to the patients themselves, which was quite tricky. But you can show that even that little change can have a big impact. And here's an example of involving consumers in publications. And what we did is we've did this workshop that I presented before, and we asked consumers for free-form contributions. Just write us a page or two, or however much you want to write, about what that experience was like. And we used their quotes from these free-form contributions and put them directly into the manuscript. And all consumers who contributed something in writing then also became co-authors on on the publication. And that's just one way of involving consumers that may not have big experiences in publications or academic publishing. And I thank you all for joining. We might have like one question, time for one question. Other than that, I'd be happy if we can collate the questions, and I'll try and answer them on Twitter in a couple of days, or to answer some coming back with the handout slides for this. If you have some time, I'd really appreciate if you also give me some feedback on this presentation. It's the first time we're running this workshop, so anything that we can do to improve it is highly welcomed. And thank you all for joining today. I enjoyed that, and I really enjoyed seeing all your input into the Slidos, because they showed me how engaged and how really thoughtful people were about what this means. So thank you, everyone. I'll stop it here, and we'll be sending around the slides and also YouTube link shortly. Thank you all. Bye.